I want to talk a little bit about reporting of information and data. When I became governor, one of my goals was to have more information available for decision makers, legislature, executive branch, more information available to the public. I can tell you that as Attorney General for 8 years, going through and trying to look at data in regard to the drug epidemic, I was often frustrated by a lack of timely information that was coming to us. And so we have started down the path. We started down the path over a year ago to increase the amount of information. It's a path. We've accomplished some things, but we certainly have a ways to go. It is really imperative in this particular crisis that we balance the public's right to know and our obligation to protect Ohioans' health privacy rights. We have to balance both of those. So far, as part of our commitment to transparency, the Department of Health has developed several data dashboards to reflect data from multiple sources, including the Ohio Disease Reporting System, hospitals, local health departments. Much of this data is updated on a daily basis, and it's also available for downloading so that anyone, any Ohio citizen, can perform their own analysis of the data. This is the broadest and at the same time most granular level of information the department has ever made available before on infectious diseases, and it is updated on a daily basis. The data we currently share on the coronavirus is at coronavirus.ohio.gov. On that particular website that you're now all familiar with, it includes the following: an overview of the coronavirus cases, hospitalizations, and deaths by county and by the day symptoms first occurred. This data is updated daily. Next, we provide a breakdown of positive cases confirmed by laboratory testing and positive cases as defined by the CDC's new expanded definition of positive cases that relies on a clinical diagnosis. And again, we separate those out so you can tell what it would have been under the old counting system, what it is under the new counting system, and people can take that and do whatever they want with that information. The Department of Health breaks down cases by age and by gender. Again, many of these things you see every day with Dr. Acton. The daily cumulative case count and deaths are broken down by new daily cases and existing cases. The Ohio Department of Health displays current trends of cases, deaths, and hospitalizations, including reports received in the past 24 hours compared to the 5-day rolling average. Ohio Department of Health provides the age range and median age of cases, hospitalizations, and deaths. Ohio Department of Health also provides the cumulative number of intensive care unit admissions, updated on a daily basis, as well as the ICU admission percentage of total cases. Further, they have tracked the number of counties with at least one case, hospitalization, or death. The Department of Health tracks and provides the number of lab tests performed. The Ohio Department of Health provides the number and percentage of cases impacting healthcare workers. And on an aggregate level, ODY provides the race of individuals, hospitalizations, and deaths as they are reported to the department. ODH provides forecast modeling of predicted cases, and ODH provides cases and tests completed for residents and staff of state-owned facilities, such as youth service cases, and testing completed for residents of state-owned facilities, such as prisons, youth detention centers, psychiatric hospitals, and developmental centers. This is certainly more information than the Department of Public Health has ever put out before. But it is a work in progress, and we're going to continue to try to broaden that, not just with the Department of Health, but in every other agency in the state.